All right. Good morning or good afternoon, wherever you're at. Welcome. Let's try that. Welcome to the Health Advocate X community conversation. You may notice that I am not Robin Shapiro. And if you've noticed that, you're correct. I am not Robin Shapiro. I am Bonnie Bazell. I'm guest facilitating today so that Robin can take a much needed, much earned break. In my day to day, I am assistant director for community for an organization called Honoring Choices Pacific Northwest. We help people do advanced care planning and future healthcare decision making. I have been a patient and family advocate for almost 20 years. I think I'm going on 17 or 18. And I'm just absolutely thrilled and honored and humbled to be sitting in this chair today. I also happen to sit on the board of Health Advocate X, so it's something near and dear and important to me. And speaking of Health Advocate X, I wanted to just let everyone know that, we would like to acknowledge, Health Advocate X would like to acknowledge a land. We want to include a land acknowledgement. And because we are a national organization, we are selecting people from across the country to do this for us so that we can hear a broad representation of everywhere we sit. So I would like to call on Sarah Morton. She is a Health Advocate X strategic advisor to give the land acknowledgement this morning before we begin. Sarah?
Thanks, Bonnie.
Yeah.
The land on which this building stands is part of the ancient homeland and traditional territory of the Wampanoag people. We pay respect to Wampanoag peoples past, present, and future, and their continuing presence in the homeland and throughout the Wampanoag diaspora. Thanks, Bonnie.
Thank you very much, Sarah. We invite everyone to take a moment and just reflect, or at least at some point learn about the land, the native and indigenous peoples of the land that you might be on. We are striving towards more equity, and it is a journey, and this is one of the steps that we're taking to get us there. All right. Well, you didn't come here to hear me speak. You came here to actually hear Dale speak. So let me introduce Dale. I'm sure many of you who have been here before are very familiar with her wisdom and her insight. Dr. Dale Reisner is Medical Director, OB/GYN Quality and Safety at Swedish Health Services. And we are very lucky to say that she also is a board member for Health Advocate X. So with that, I'm going to turn it over to Dale, who's going to start us off as these conversations usually start off with an update of COVID numbers and what's going on sort of generally nationally. Dale?
Hi, everyone, and welcome. And I have a bucket of stuff to talk about. So I'm going to try to break it up into sections so that your questions can be vetted as we go along. I imagine that there's a lot of questions. There's quite a few of you on today. So lots have been going on. You are obviously aware of the increase in COVID cases that we have, not only in the US, but across the world. So big swarm of cases, numbers are up, lots of places, some places worse than others. So I'm gonna give you a little bit of insight. Just, I always start a little bit with global, and but obviously focusing more on the US. In the past, I've given Washington state data. I'm not doing that today. It's all going to be US data. So across the world, we are now at over 203 million cases of COVID. There have been 4.3 million deaths, probably more than that, because many of them have not been COVID positive for sure, particularly in the early days, but even in some of the less developed countries, they're not all getting COVID tested. That is not talking about any deaths that might have been related, but not due to COVID. And we know some of that is happening. We've had that conversation in the past, and we'll revisit that in the future as well. So in the United States, we are actually leading. Unfortunately, this is not an area we want to lead, but in the most number of new cases in the whole world. We have 35 million, over 35 million, getting close to 36 million total cases in the US, with over 614,000 deaths in the US. And just in the last week, we have 632,000 new cases in the United States. This is followed by India, which is in the 200s, Iran, which has also over 200,000, and the third most common is Brazil. So this is like total number of cases. This is not per 100,000 necessarily, which is what you would want to do as a leveling. But just to let you know, this is everywhere. In the United States, the new cases are over 93% due to the Delta variant. We will talk a little bit as we go. I'm going to give you a little bit more numbers, but we'll talk a little bit more about vaccinated versus unvaccinated and who's getting sick, and why vaccinated people might be getting sick. So there in the United States, over 351 million vaccines have been given. That is not fully vaccinated, right? Those are vaccine doses. And we know that we are not as high across the entire country, and that there are a lot of pockets that are very well vaccinated and others that are not so much. And even within a state like Washington State, where we're running around 70% vaccine rate, at least one dose, we have pockets where it's quite low. So anywhere from 30 to 50%. And so that has to do, and we'll talk about this a little bit too, is who's not getting vaccinated. And I'm sure we probably have people on this phone call that aren't vaccinated, and many who are, and we'll talk a little bit about that as well. So it's a super high rate of community transmission, not so much people coming into the country, but across the country, people who live in your community. And there's a map of the community transmission, with red being the highest. Almost every single state is in that situation. And the next down, the moderately severe is orange. Everything else is orange. So there's nothing within the continental US that doesn't have very high community transmission rates. And that really speaks to whether you're vaccinated or not vaccinated. Please do not go out in public without a mask, particularly if you're anywhere indoors, in order to protect yourself, in order to protect your clients, your family, your friends that you're around. We have been shut down in the past. We don't want to have to go there again. In order to really get a handle on all of this, we need to still continue to protect ourselves. We'll revisit that. So a few more numbers, and then I'll take a break and see if anybody has any burning questions. So the other numbers that you might be interested in is really what's happened, over the last couple of weeks. We've had this huge increase in cases. So 7-day case rate is running in the US 210 per 100,000. So remember, I said that's probably our leveling number. But that means we've had, over 600,000 total new cases, just in terms of numbers of cases. And we are running now 10 positives per test. And we've not ever been that high. It's running at our peaks in the past around 5 or 6 positive cases per test run. So it's definitely there, and it's easy to pick up from people. It still can be very asymptomatic and mildly symptomatic. The highest case rates right now in over the last 7 days are, and this is cases, are in Florida, Mississippi, Alabama, Oklahoma, those states. The death rate, however, is in a different set of states. There's some overlap. And Texas is leading with the highest number of deaths in the last 7 days, Louisiana, Arkansas, Missouri, and Florida. So we have varying degrees of vulnerable populations, and that's a little bit why we're seeing that. And the overwhelming number of people who are getting severe illness and who are dying are unvaccinated people with the Delta variant. So we know the Delta variant is easily transmissible. It's as infectious as chickenpox. The initial SARS-CoV-2 variant virus that we had in the country was not that easily transmitted, and we sort of were saved. I think some people were exposed and didn't get sick. And that's why we were talking about super spreader events. Now you don't have to go to a super spreader event, you just have to be around someone. So make sure that you and your clients and your family members are wearing real masks to protect yourselves. The gaiters that kind of come up and are a little more comfortable to wear will not protect you very well. It may protect the rest of us from your spray when you cough or talk or sing, but it's not going to protect you as well. So make sure your mask fits very well, that there's no gaps, the things that we already have heard. And you can help anyone that you are assisting with care, as well as family members with this also. The other thing I wanted to mention is in the United States, we're seeing a big swarm of children who are getting sick and seriously ill. And you may have read about the 11-month-old baby that was sick enough that he or she needed to be intubated. They could not find a bed in all of Houston for that baby to be admitted in. It had to be transferred out of the area. Follow up on that is that kiddo is doing better, still is sick, but was able to be extubated. But we don't have vaccine for kids that young yet. And I'll talk a little bit specifically about vaccines and kids later in the discussion, because that I'm sure is on people's minds. Even if you don't have school-aged children, clients and other family members and friends will. So in the last week of July, there were over 70,000 kids with confirmed COVID infections in the US. So that was 19% of the reported cases. So it's really on the rise. And this is not, there is school in some places, but not a lot of places. So we can't really even blame it on school. So can you imagine when they start going to school, and some of these states where there have been mandates by the governors of not allowing even individual schools or companies to mandate masks or vaccinations, that we will have continued really serious infections, and we're going to lose some kids, and we're going to lose some vulnerable adults from this. So let me just take a quick break. I don't know if there's anything, there's a couple things in the chat box I can
Yeah, we've had I'm wondering if you can, we've had two questions really. One is I'll start with perhaps the less lengthy one first. Someone wanted to just chime in and ask, for your guidance on, are cloth and surgical masks okay? Do we need to be looking at N95s or KN95s?
Yeah, there's no recommendation. I mean, if you really want to be careful, pick up some KN95s. You can get those at pretty much anywhere. If you are immunocompromised, I would wear those. And those you need to be sure fit you too, because I've purchased some, and some of them are a little bigger, some of them are a little bit smaller. They're not all labeled the way the formal N95s are for healthcare workers. But I don't think you need to go the full N95, and you would have to have that fitted properly and all of that. The cloth masks, 3 layers is what you want. If you have a 2-layer with a place for a little filter and you want to put a filter in, that will give you very good coverage. So all of that, if you know anything single layer, the bandanas, any of that kind of stuff is not going to protect you very well. And then Margaret asked about 10 positive cases. It's not,
Yeah.
So it's, I guess when I say test run, so per any, one test is one person going in either symptomatic or before travel to find out if they're COVID positive or not. So every test for out of all the tests that are being done, in the past, we had 5 to 6% of those tests being positive. Now it's in the 10% category. So there are people, we're hearing even people traveling that are having unexpected positives because they're asymptomatic, and they only are doing the test because they're planning to travel. So out of every test that's being done, the positive rate is now about 10% instead of 5 or 6% or less in the past. The other thing I did want to mention as we start into kind of talking about vaccines and so on is that it is actually National Immunization Month, which is kind of a fluke that we have this huge swarm in August of cases. That's when we have this month every year, so it's not specific to COVID, but it really highlights how different people are addressing the COVID vaccination as opposed to other acceptable vaccinations that we're used to. So flu vaccine, measles, mumps, rubella, tetanus, you name it, right? We get a lot of vaccinations, hepatitis B. So it really speaks in part to why people are interested in vaccinations and why they're not. And I want to talk a little bit in more detail about that. I did want to mention a little bit about the breakthrough cases and also the fact that the Delta variant is out there. So as best we can tell, as I mentioned, a really high rate of our current infections from the Delta variant. It probably isn't more severe. We're seeing really severe complications in unvaccinated people. And there have been a host of breakthrough and some serious and some deaths in fully vaccinated people, but they are immunocompromised for one reason or another. And there's a recent story I read about a woman who I think was in her 40s who was vaccinated, not feeling well, went in to the hospital, was tested, found to be COVID positive, and subsequently died. And that the only thing shared about that person is that there was significant increased BMI. So she was in an obese category for weight. And we know that really higher body weight is associated with a little bit of change in our immune response. So I want it really clear. It's not anti-obesity. This is not a bias, and there are biases for sure about obesity, but there really are differences as we accumulate more body fat in how our body responds to infections and to some of the things that we see as higher rates of complications in medical care as well. And this is one. There are people with multiple medical complications. If you add hypertension, diabetes, and more things that make somebody less, the body's kind of on fire all the time, trying to take care of all these complications. And so when they get infected, they are also more vulnerable to the severe disease and or to death. So you will hear this. It doesn't mean the vaccine doesn't work. And in somebody who is overtly healthy, but maybe is a little bit older and has nothing else going on, we're not seeing higher death rates in that population. I'm very happy about that because I'm in that group. But we still want to be careful, and that is why it's so important to not go places. You don't have to go where there's crowds, and if you do go places, please, for sure, mask when you can certainly mask outdoors, but at least before you walk in the doors of a place where there's a lot of other people walking around. And you'll notice that if you go out in public now, there are a ton of people not wearing masks, and you don't know if they've been vaccinated or not, and you don't know if they've been exposed or not. So that's just sort of better part of valor for your personal.
Gail, can you talk about so the thing that I've been asked a lot about is kids and masking, because it seems like it's up to the parents.
Mm-hmm.
Are there age, like, is there a cutoff? I know they're going to start vaccinating younger and younger, but right now you go out in public and the parents have the masks on, but the kids don't. And it's just,
what the original recommendation was that it might be challenging for kids younger than age 2 to wear a mask, and babies should not be masked because they have limited abilities to breathe anyway. They're obligate, newborns are obligate nasal breathers, and so you don't want to be masking little babies, but you can keep them out of harm's way. So you don't always, sometimes you don't have a choice. You have to go to the store, you have to take them with you. And I'm not suggesting we leave them in the car alone either. That's not good. So yeah, I mean, it's a catch-22. You have to go about your business. But where you can be more cautious, and if you have another family member or somebody that stay home with the kids, I would err on the side of not taking them. Take them out to the park when it's not as busy and there's not so many kids around that you don't know. Keep them in their cohort of either siblings or friends, kind of like we did originally, but without the formal lockdowns approach. The kid, I'll just fill in now. I looked at what is the anticipated date that the FDA is going to finally approve the adult vaccines. Instead of for emergency use, they will be just fully approved. And now the anticipated date is by Labor Day, maybe sooner. So there's a lot of pressure when we talk about, and in a minute, I will spend a little bit more time talking about unvaccinated and how we can help those who are open to vaccination but hesitant, maybe feel more comfortable about it. And I know that having full FDA approval is going to make a difference for some people. For the kids, both Pfizer and Moderna had, they started vaccination trials in children in March. They will be complete by September, and they will have data available by sometime in September. The need for the FDA to fully approve those, they are asking for at least 4 to 6 months of safety data after the effectiveness data is available. And they're, this is what they do, right? For the adult vaccinations, they wanted X period of time. For the kids, they do as well. And it's a little bit longer for kids because, sometimes kids respond differently than adults do. So that's kind of the time frame, midwinter, probably, before they actually will formally approve it for children. And let me just give you the age breakdown because it will be divvied up a little bit. So the vaccinations for Pfizer, the 5 to 11-year-old data. So now it's, we're looking at 12 to 18, 12 to 16, depending on the vaccine. That will be out soon. The data for 5 to 11-year-olds is anticipated to be in September available. doesn't mean that the vaccine will be available, but the data will be available. And for the 2 to 5-year-olds, probably a little bit after that. And 6 months to 2-year-olds is going to be later. So we still need to protect our children. I think it's really, really hard with kids going back to school, expecting children to keep masks on the whole time they're at school. The other conundrum is that, people have looked at hybrid models of in-person versus home computer access, and the hybrid models are not that good. So, getting kids back to school is really important for their social skills. There's some trauma associated, some stress, really big increases in anxiety and stress. When kids are kept home, then they're afraid to go outside, even if their adult people say it's okay. Now their fear is probably warranted. So how we get kids back to school safely, I think it's going to be really challenging. And I think that masks are our best bet in good hand washing, a little, hand gel challenges. And I think it's going to be harder for folks when they're sending their kids to full
Dale, you're kind of
day
going
school,
out.
as
You're,
well.
You're in and out here. Yeah.
Let me pop onto a different setup.
Well, and we were just talking about how the hybrid model doesn't always work, and we're seeing real time why it may not work for kids for learning, right? Sometimes we have to change. Lots of good information there, Dale. Tell me when you're back up and ready. We have a couple of questions.
Sure.
In the chat. So the one I want to ask, sticking with vaccines, there has been some talk about the fact that the mRNAs are effective for 6 months, and do we need a booster shot and all of that. I'm wondering if you can unpack, this idea around the booster shot and how effective a vaccine is and what the current science is telling us. Well, I think we've paused. She's paused again.
Yeah.
So as soon as she comes back on, we will continue and ask her that. But I think I think what she was saying about protecting each other by wearing a mask and sticking to those things that we know help us, right? Washing hands, staying distanced when possible. Did I see her again?
He's back. Yay.
Back, yay! Yay!
I can't tell that I'm popping in and out. That's really weird. I'm going to switch to my backup internet. Sorry about that.
That's okay.
Yeah.
Can't control the skies, I guess.
I don't know if you heard Bonnie.
I didn't hear that. Yeah.
So there, Carolyn asked, what about booster shots? And also someone else
right.
asked, is it a 6-month coverage for the current mRNA vaccines? And, what does that mean? Like somebody like me, I'm past 6 months, but there's no booster yet. So
right.
Is there any information about that?
Boosters are challenging. I know Dr. Fauci is recommending boosters when available. We have a lot of vaccine available in our country because we have a vaccine that was ordered that some people don't want to use. So there is the potential to do boosters. But we also want to be sure that vaccinations are available globally, because the moment we travel or somebody travels to our country from a very low vaccination place, even if they test negative before they start their trip, they may be harboring the virus and you don't know till they get off the plane. So it's that balance of global society assistance versus what we have in the US. If nobody was traveling out of the US, we could focus on what we're doing here. Even then, I think we have an obligation to the world. Many of the goods we use are made other places than the US. And so the booster idea, I think, will come to fruition. I just don't know when. And I also, because I'm in the hospital, part of my work, was vaccinated pretty early in the availability of the vaccines. And so I'm cognizant of that myself. Happy to bring this group the latest information when we have it on how boosters will be applied. And I suspect what's going to happen is the boosters, and this is how it should be, should go to the most vulnerable, the most immunocompromised people. We know that there is some data, and I don't know whether it's been fully published or not, but folks who are receiving cancer treatment who are really immunosuppressed may get very low response, even for full vaccinations, in terms of the amount of antibodies they produce. And that makes sense, right? Because they are purposely being immunosuppressed for their cancer therapy. And so that group of patients, of course, you would want to get the booster. Those of us who are in older age groups may be in line next. The significant comorbidities, as we see who is getting sick from the Delta variant, we should be boostering that population first when there are boosters available. And right now the booster will be, more of the same, or maybe if you got Pfizer for the first time, maybe you get a Moderna. There's some question as to whether you might get benefit by using, by having exposure to a slightly different vaccine. Uh-oh.
Yes, we can still see you and hear you.
Yeah.
It clipped a little bit, but I think the messaging behind that was, at least what I heard, and correct if I misheard, that it's likely that those boosters will go to those who most need it in sort of an order that makes sense according to need for protection.
Yeah.
So, I want to just reiterate and re-hit this idea of how we can keep each other safe. We're seeing some people say it seems conflicting. So for masking, I heard you say, correct me if I'm wrong, that definitely masking is important. Is that important all the time? Is it just indoors? Is it outdoors too? What would you recommend for us to make sure that we're keeping not only ourselves safe, but our families and people that we might advocate for?
Right. I would say whenever you're inside with, particularly with people that are not in your immediate cluster, that where they've been, and in your immediate cluster, sometimes you have to think about it. Like I have family members that are very, very, very protective. I'm kind of in between. I do go out because it's just me. So, I haven't had my groceries delivered or any of that kind of stuff. That's always a possibility if it got way worse. But yeah, I think you want to be minimal contact. I'm noticing that there are some places that are being very, very careful, some restaurants, some grocery stores, some other types of stores. And those are the places I'm going, because I just went into a pharmacy and I had a mask on. It's a tiny pharmacy. And I went in and they have mask signs, and somebody else came in and the person at the desk did not have a mask on. And I said, "Are you not doing a masking policy?" "Oh no, it's up to people's option if they're vaccinated." I'm going, "Well, you didn't ask those people they were vaccinated." So I am never going back to that place, because, not only the people that were in there in front of me, which I stayed away from, but the person that rang out my my sale wasn't masked. So I think you can do that, be really careful without being crazy about it and without being afraid of stepping outdoors. And I had a family, we had a little family burial ceremony yesterday with my close family members, and we ate indoors without masks because we know each other and we're all vaccinated. So I think you need to be reasonable because we all have emotional needs. And when we get stressed out and we don't have support, we also get sick from that. It's a balancing act, and it's a little more challenging these days than before COVID, but probably we should have been a little more careful before that anyway, right?
Right.
Yeah. I did want to talk a little bit more about how we can help people who aren't vaccinated and who might be available for in terms of their, they're thinking about vaccination.
I'm also talk about
So the biggest thing I think for a lot of people is that final FDA approval. So we'll have that soon. The next would be, and I saw a really great thing from the state of Georgia where they're really doing a huge community campaign. I don't know if any of you guys are from Georgia, but kudos to Georgia because they've had challenges with vaccination. And they've got billboards. They've got some open billboards where people can add their own little stories or their little verses. And so that is one way. So community conversations that are coming from the community, really important. Trusted religious leaders have a huge impact. Religious leaders who are anti-vaccination have a huge impact. So where there are folks who are religious leaders who from whatever religion, whatever philosophy, whatever group you might belong to, really helpful if you're vaccinated and you don't think that that leader is anti-vaccination, speak to them and see if they can put that in their sermon, if they can put that in their newsletters, any of those kinds of things, because that does make a difference. When you talk to people who have just finally decided to go ahead, listening to someone they trust, and a lot of people do not trust the government, and I get it. I understand. I'm sad that a lot of people don't trust the sort of core science that our public health folks embrace and take care of, and that our virologists have been helping us with for so long, but that's the way it is. There also are community centers. So if you're working with anyone who is from a different country, we have Ethiopian community centers. We have lots of different new immigrant populations that have community centers where there might be the ability to put information there or to talk to the folks that are leaders in their communities. And then what we're seeing more and more of, sadly, is stories. So stories hit us, and the stories of somebody that was a strong anti-vaccine person who got really sick, some of them are speaking from their beds in the hospital after being there for a month or two. We're seeing people who were really ranters about anti-vaccination who are dying from COVID. So those stories, even if the folks you're working with are not seeing them, you can share with them, and you can pull it up on YouTube, you can pull it up on the internet and show these folks that have changed their mind and wish they had. And sadly, a lot of them were vaccine hesitant. So we're in the African-American population, there's been decades, 100 years of not equitable treatment and some really, horrible stuff that's gone on with with research and so on. So there is a big distrust of the medical community for many African-American populations and individuals. And so, you know, there was a recent story from a woman who was who is African-American and disabled from a really horrible home accident, and who was very hesitant. And her sister she survived, but she was in the hospital critically ill for 54 days. And through the course of that, and being the person who was the connector with her rest of her family for her sister's course, she changed her mind about vaccination. Now, you know, she, of course, like, is somebody that you would anticipate might be afraid to have a vaccination. She's also, you know, physically disabled and very vulnerable to maybe side effects. So when you get those kinds of stories and can share them with people that are hesitant, sometimes that makes a difference. So those are the kinds of things that I thought might be helpful to share with you guys as people who are in various areas of advocacy across the country. Wow, yeah, one local church from Bonnie that vaccinated 800 people. Here's an amazingly cool thing, and I just came across it today because, you know, our native populations, we started with a land affirmation. Our native populations, percentage-wise per population, is the most highly vaccinated population in our country right now. And when we look, it's amazing. And why? Because they did it on the reservations, and they did it with local people they trusted, their local health people. And so that really speaks to, can we get into communities? And I participated in some of the early mobile vaccines. We went to hearing impaired communities. We went to African-American populations. We went to newer immigrants that didn't necessarily speak English. So we were vaccinating with interpreters, and it was so rewarding. And when you get into those communities and they see that other folks are there too, that are their friends and their neighbors, it makes a huge difference. So that I was really thrilled to see that that data in the native population, because COVID has hit their population really badly.
Mm-hmm.
Yeah.
And hopefully they will be taking vaccines to the schools when the schools are back, but that's going to probably be
Yes.
Up to the schools and the states. And
Right.
Yeah.
Right.
There's an article in the New York Times today about long haul and kids.
Yes.
And I'm just curious, I mean, I know there's not a long-term data, but is it teenagers more than young kids?
I don't think we know that yet. And I'm hoping that maybe at our next community conversations, we can focus on long haul. I've just met somebody recently who is a victim of that themselves. I'm going to have a little conversation with that person and see if maybe somebody wants to come and share briefly their story on this. And we'll see if there is somebody besides me, you might be sick of hearing from me all the time, who can come join us as an expert in that. And if not, I will gather everything I can that we have that's actually, looks factual. It is really hard right now. A whole lot of reported stories. There's a wide range. And my sense is from watching this, for the past year and a half now, is that we will have some people that appear to have really long resolutions of their symptoms, but will eventually be okay. And we're going to have some people that won't be okay. And how we figure out what that is, I think, it's still going to take some time. And that leads me into something I wanted to be sure you guys all, that I don't want to offend anybody and be overly simplistic, but I thought it might be a good time to talk a little bit about what is an outbreak, what's an epidemic, what's a pandemic, and what's an endemic. Because we're in a pandemic right now. So an outbreak is a cluster of cases that's acute and unexpected. In Washington State, we had an outbreak of measles in a certain area of the state. And fortunately, it didn't end up becoming something that spread too far beyond our state borders. It was considered a local epidemic at one point, but it started with an outbreak. And so when you have an epidemic, it's once it starts spreading. So you get community, a greater population, regions, more than just one region, then it becomes an epidemic. And so China was an outbreak that became an epidemic. And then once it starts crossing borders, it becomes pandemic. So, and I saw a really clever thing. So the P, when you go from epidemic to pandemic, you're kind of adding a P for passport. It goes and travels across borders, across states, across countries, across the globe. And it's a much bigger number of people, and it is something obviously that becomes much harder to control. So we're in a pandemic. We're not done with a pandemic yet. When we see huge surges of cases, in some places they're having surges right now that are way higher than what they had before we had vaccinations. And as I mentioned, the majority of those cases are in people who aren't vaccinated, but some are going to be breakthrough cases, those of us that are vaccinated that get ill. And we are going to end up, this is not going away. So when the pandemic is done, we're not going to be done with COVID. This virus is very, very versatile. And we will continue to see variants. So there's a new variant in the United States called Lambda. We don't know enough about it yet. It's probably pretty close to the Delta virus in terms of infectivity, but we don't know for sure. And we'll see more. You'll see more in the news about it. There will continue to be, as long as we have not enough people protected, once the virus gets in the human body, and it can change, it takes over the cells, and it can continue to mutate and change, and we'll see different variants. So we'll be living with that. You'll see some of that. But as we get where more people are protected, so the virus can't inhabit or can't replicate the cells within the cells, then we will end up with an endemic situation. So examples of endemics would be malaria in Africa. Never goes away, right? They have swarms, but when you go to Africa, you prepare yourself. You can prophylax against that. We have the flu. The flu is endemic. It happens to be seasonal. We've never gotten rid of it totally, but we can protect against it. And COVID is going to be just like that. Now, whether it settles into a season of the year, whether it's present all year round, we won't know until our cases go down and we have more people protected from it. So I just wanted to kind of right size a little bit expectations, because we're not going to be out of the pandemic for a long time. When we get out of the pandemic, and cases across the globe are down and the transmission rates are very low, and people are getting boosters on a regular basis or whatever, it becomes a more traditional vaccine that people are used to, that they would get on a regular cadence, then we will probably be in that endemic situation with COVID. So any questions about that? Does that make sense?
Yeah, that's helpful, actually.
Yeah.
There's a question that Judy West put in, and I think, Judy, I can answer it because I've talked to Dr. Gupta about this. It was about getting long haulers healthcare, because there's actually no ICD code for long haul. But he did put me in touch with a group called Survivor Corps, who are working with long haulers. And they are working hard at that. They're trying to change that. And Dale, you probably know something about that, but right now there's no ICD code. So they have to list it out for different diagnoses that aren't called long hauls. But I think that's going to change in the future.
Yeah. And I think right now what they're doing is, depending on what the leading symptoms are, that's going to be neurologic disorder, or, because some people have weakness and headaches, and brain fog and that kind of stuff. And there's all kinds of other symptoms, but those are really common symptoms that we're seeing and hearing about. Yes, in order to do that, we need a definition of what long haulers is. So that's the other problem, because the virus affects so many different areas. It's tough. I think that that is a big need, because we had a community conversation where we talked about long haulers, and with, recommendation to start with primary care, and then have the primary care do certain things, and then refer to specialists as needed, depending on if you have pulmonary complications, or you have chronic lung disease, or shortness of breath, or that kind of thing. You would see that specialist. If you have some of the neurologic conditions, you would see that specialist. And I think that's still the approach we have to take. It's painful, because getting in to see your primary care provider might take you 3 months, because you don't have an acute problem. So our system is not set up to work with this. Well, it's not really a system, right? Don't get me going on that. Yeah. But yes, I think that I've heard about Survivor Corps working towards that. And I think that some of these specialties will be pushing for that as well. And there's power behind when they change codes, having multiple specialties asking for the same thing will be very helpful to get something like that done.
If I may, there was a question in the comments that I've also experienced, and that was a friend's daughter didn't want to get vaccinated because of reproductive concerns, fertility concerns.
Right.
How can we've talked about how, getting vaccinated is a great way to protect yourself. How can we help people understand that their reproductive health will still be okay? What are some things that are resources or anything?
I don't know if so. There are, in the infertility realm, there may be something from the infertility group that both American College of Obstetrics and Gynecology and the Society for Maternal Fetal Medicine have come out with a joint statement supporting vaccinations, encouraging vaccinations. We have been, when we first started last year, when the vaccines first came out, they had not been tested in pregnant women. I think they're done with that now. They sort of did that as a secondary thing. But we know there were a number of women who were finding out they were pregnant after they got a vaccination. So they were first trimester when they got it, which if you were going to have an impact, it should be from that, who've not had any problems. So we are strongly recommending vaccinations in pregnancy. Pregnant women are immunosuppressed a little. Otherwise, we would reject our fetus, right? Because our fetus is half not us. So it's really, it's foreign tissue. I tell my kids that, yeah. Pregnancy is this miraculous thing where we have just the right amount of immunosuppression to not reject our fetus. So it's kind of like graft versus host, and yet not so much that we're sick all the time. But we do know that with most viruses, pregnant women are more vulnerable. We have seen now collectively data across the country about COVID infections during pregnancy and their impact. So much more likely to be intubated, go to the ICU, possibly higher death rates. But even community-acquired bacterial pneumonias take their toll on a pregnant person more so than they do in someone who's not of the same age. So yeah, reproductive age women for sure. They should be considering vaccination, getting the vaccination, unless they are just totally against vaccines in general. And that group, I'm not sure what can be done with that. And then I think that for those who are worried about, eggs and all of that, there's absolutely no indication that there's any impact on any of this in terms of fertility. So I'm not, I can look and see whether the fertility associations have put anything out, but I know that people have looked at IVF treatments and all these other things, and there appears to be absolutely no impact on that. So I don't know if that's helpful, but.
Thank you. That's very helpful. And it's something that I can take back to the mother of the 20-year-old daughter and sort of help her understand.
Oh yeah. My daughter-in-law is pregnant and she was right in there getting vaccinated, but she checked with me first. So that was nice. Yeah. Yeah.
But I wanted to make sure everybody saw Tanya Daniels put in that the advisory committee on immunization is meeting this Friday to talk about shots for immunocompromised. So, and she put the link in, we could listen, but yeah, I have lots of people have asked me lots of questions about that. Immunocompromised folks. So thank you, Tanya.
Yeah, that's great. Yeah, that's a tough group. I'm sure that vaccines in general don't work as well for that population. And, people undergoing cancer therapy have worn masks for a long, long time and done quite well protecting themselves. And in fact, with the early COVID, before we had vaccinations, we know that that those people did well and actually had fewer infections than the general population. So, watching your exposures, I think, is really critical. And without depriving yourself of the social contact that we all need to be mentally healthy, because our mental health is rolled into all the rest of our health. We just have to convince the country that that's true. Yeah. The separation between mental health and the rest of the body has never made sense.
There was another question from Carolyn Giza about, did the CDC stop tracking breakthrough infections in vaccinated individuals? And I'm just curious because they must be keeping data on that.
Stop in which
Didn't the CDC stop tracking breakthroughs?
No. I just got if you signed up for the VSafe program, I just got a question. Probably a week and a half ago from there, have you had anything? Have you been COVID positive? Are you pregnant? All these questions. So they're still tracking. I think breakthrough, probably it'll take us a while to see what percentage. And again, if you have comorbidities, then, that's the group that I think we're seeing the breakthrough in more. Certainly the sicker breakthrough is happening with that group.
Mm-hmm.
Yeah.
Well, and we don't know what percentage of people vaccinated did VSafe.
We do not.
Right.
We do not. Yeah. We have just a few minutes left, and I just want to kind of circle back around, obviously, if there's any last questions, but just that, what we can do in the advocacy community, protect ourselves, recommend the simple things such as masking, again, the 20-second hand washing and or hand gel. Carry some hand gel or spray with you everywhere. Go back to being a little bit more meticulous than maybe what we've done in the early months of summer. And try to be supportive. If you're working with someone that's totally not interested in vaccination, no matter what the FDA has to say about it, that those people have their reasons for it. We choose, we have freedom of choice a lot in this country, and that's a choice that they're making. There may be consequences that they need to live with if they make that choice. So if they want to go to the latest play and the play says only vaccinated people, show us your card or whatever. I don't know that any place is doing that, show us your card, but then they've made their choice. They've had the ability to make the choice to not get vaccinated. Then the playhouse can make the choice of not letting people in that aren't vaccinated. And I think we need to level set a little bit for those that are looking at individual rights. We don't want those taken away for sure, but we live in a society, and this is why we have a pandemic, is because we live in a society that's very busy and complicated. Mm-hmm. Yeah. Oh, 250 bars in Seattle are now requiring vaccine cards. Wow.
Yeah, I heard yesterday from
Yeah.
Tom Douglas, who's a friend. He has multiple restaurants, that today all his restaurants are going to full masking. So we're back to that.
Yeah, Seattle Repertory Theater, and yes, because we want those things to survive. We
Yeah.
want to be able to partake in them, so they should have the ability to do that. And then there are some, Washington State, not the whole state, but parts of it are fairly progressive and understand that. And some states are not that way. They're a little bit more, individual rights, a little bit more conservative about what they want to, say is a global thing that people should do.
Mhm.
And if you live in an area like that, then you live in that area, and you're going to have to adjust your personal behavior based on your own sense of safety. So yeah.
Mhm. Yeah.
And I think that is a perfect place to sort of wrap it up.
Yeah.
The idea of that we have all these choices to make, and we can make them and understand. So we can choose to wash our hands and wear a mask and get vaccinated, and we can choose to help society sort of mitigate this problem, this pandemic, hopefully. And Dale, thank you so much information packed into one tight hour. Thank you so much. We know that there are going to continue to be questions, so come and join us for another community conversation where we'll talk more about this and other things. We talked about possibly hearing a story about long COVID and what that's like. So make sure that you stay in touch with HealthAdvocateX so you know what's coming up next. We do post recordings of this, so if you think you missed something, you can always watch it again, or you can share it with someone. Is there anything else that anyone needs to add? Beth or Dale, anything else?
Nope. We'll see you all next time.
We'll see you all next time, and have a great week.
Yeah,
Thanks, Colleen.
just take good care of yourselves.
Very good care.
Yeah.